you look at statistics, we know, I mean, it's legitimately the majority of people are going to have some sort of health crisis in their life, mostly avoidable. That's where we're at, is we want to stop that. Yes. Heart disease has to be the number one. Nobody should have heart disease. I mean, like literally, nobody should. Even if somebody's eating a standard diet that is maybe poor for them, you can see so many steps ahead on laboratory work that like, hey, things aren't looking good, or hey, things are really not looking good, or man, we got to change like yesterday. You know, you see this stuff literally years in advance. You can say these dynamics shouldn't be at play, or hey, this number's starting to go up, and next this one is going to go up, and then after that we got problems. You know, so that's very, very avoidable. Sometimes with certain genetic variations even. I had a patient who's like a triathlete, exceptional shape. She's in her 50s at this point, and had been on high blood pressure medicine for like 7 years, or 6 years maybe, but just a long time, and it didn't make sense because this person eats clean. And so we did a test, found out she has a genetic abnormality, which basically means that she doesn't do something called methylation well. Off of blood pressure medicine in a month, literally with just a couple of diet tweaks and a couple of vitamins that she was lacking in. Meanwhile, you know, the longer you spend with high blood pressure, the harder and thicker your arteries get, which means we're like barreling towards heart disease. Sometimes it's as simple as that. Other times it's more complicated, but heart disease is definitely number one. It's the number one killer in America, and it's like shouldn't even be on the list. I think diabetes is another big one. Again, it's very reversible. A lot of times it can be reversed with diet, but something in the ballpark of like 90% of people with pre-diabetes don't know they have pre-diabetes. And so again, it's just this kind of slow crawl towards a disease that if you see it early enough, you can make pretty easy changes to avoid that altogether. And then another one, I don't know if this is top of the list or not, but I think for me, one that I'm particularly passionate about is just degeneration in people's spines and in people's joints. It's very misunderstood as far as the general public has kind of been sold this narrative of it happens when you get older, you're going to degenerate. And people don't realize that's a dynamic response. Your body will restructure joints in response to pressure. And so if there's too much pressure on a joint, which can be measured we can do images and there's biomechanical assessments, like we can measure this stuff and change it. But basically a joint degenerating is actually just the bone trying to grow bigger because there's too much pressure on it. So it wants to increase its own surface area. So your body's trying to fix the problem itself. So in spinal degeneration, it's so common that the pain associated with the degeneration gets treated with injections, pain meds, whatever, but nothing's done about the fact that there's too much pressure there. So that's one thing that we do that's somewhat unique here, is that we really work a lot on like reshaping people's spines to redistribute pressure. It's been shown definitively in literature, if you have a joint that's degenerating, you can see it before somebody feels it, but typically by years. And we know that process never stops, literally, until your spine fuses to itself, unless pressure is removed from the joint. So even when somebody goes and has surgery, if they're one of the lucky few who has a good result, they won't have a good result long term because the process still is ongoing. So that's one thing where we just can offer like a unique permanent solution to. You can get somebody's spine to carry weight normally, which usually means reshaping it to an extent. You stop the degeneration in its tracks. It's been proven. A study came out last year that showed that long-term follow-ups. So just one thing that's like, I think 80% of the population has degeneration in their spine. Probably 0% should have it, and 100% of those with it could stop it from getting worse. So again, something I'm kind of passionate about, just because it's one of those that's just like everybody's got it, but they don't need to, because it's been kind of talked about for a long time, but nobody's been able to like have research to show. But there's like certain electrical signaling that is what creates this feedback loop. So that's kind of really nerdy stuff. Basically, if you put too much pressure, there's like thresholds in these different joint tissues. Basically, if you see a certain pressure threshold, it creates what's called a piezoelectric effect, but the physical pressure creates an electrical impulse that sends information that your body will then come back and start making more bone there. So that feedback loop can be broken.